Hi, I'm Dr. Herman, and I want to share with you for a brief couple of minutes here one of the very important systems in your body which needs to be examined in order to help you figure out if there's some block in your body's ability to heal. And that's whether it's from an autoimmune disease or a cancer. And every kind of inflammatory chronic condition on the planet, you have to be concerned about whether or not your immune system can do the job. Well, there is a part of your immune system called and I'll spell this out on the screen for you, called the reticuloendothelial system. Long word. Let's call it RES for short. So again, reticuloendothelial system, or RES for short. And that includes your phagocytic cells. It includes your macrophage cells. These are cells within your immune system that actually go out kind of like that video game Pac-Man that would engulf something, eat it up, dissolve it, and then let go of the leftover, the remains of the dead bug, let's say. So when these cells go out and they're able to trap the infection and or toxin, gobble it up, and dismiss it from the system through maybe your urinary tract or through your colon, let's say. So this system has to be in perfect working order. And one of the common findings that I discover when I'm examining patients who have chronic disease like lupus, like multiple sclerosis, like thyroid disease with chronic fatigue, or they have depression, or they have neuropathy, or they have heart disease, or they have cancer, again, whatever, or arthritis, whatever chronic ailment, I do see very frequently, not every time, because this is an individualized approach, but I see very frequently that the RES, the reticuloendothelial system, is being blocked from its ability to be able to help you fight and remove the infections, to find them, eat them, and remove them from your body. So if you're suffering with Lyme infection, if you're suffering with mold, if you're suffering with all different kinds of bacteria and worms and viruses, and your RES is under normal function, if it's under the weather, what would cause it to be under the weather that won't let you to be able to fight? So if it's under the weather and you can't win the war, so what would cause it to be so stressed where it can't function appropriately? A, you may have electromagnetic stress from your cell phone, from your car, from your computer, from the Wi-Fi in your town, from the wires in the walls where you live, from the outlets that are in the walls right by your bed, from all of the electronics, from the radio waves in your environment. Very commonly, I find that electromagnetic field stresses that are very common in today's world are inhibiting the reticuloendothelial. They're causing that RES to not be able to go out and fight the war for you. So it's like saying you have soldiers on a battleground that you just zap and put them to sleep. They won't be able to fight the invaders that are coming in to your town. Does that make sense? You've got to be able to check this RES system and make sure that it's working appropriately. What does the RES include? You know, you've got lymph, you've got spleen, but in particular, you've got to make sure that these macrophage cells are up to the job to be able to help you find and fight, eat up and spit out these infections. Because just taking a remedy for an infection, or taking an herbal therapy, or a Rife machine, or some other kind of, or enemas, or some other kinds of therapies, and your RES is being inhibited by an environmental stressor, you're not going to win. It's almost physiologically impossible. So one thing that I do in my clinic is to check for the RES and see that it's working appropriately. If not, we're going to figure out why, what's causing it to not be able to do its job, whether it's electromagnetic stress, or there's some chemical exposure to something, or something to that degree. We're going to find it. I'm going to find it with you, and we're going to provide you with specific remedies of specific potencies that can help you remove the cause of the inhibition of the reticuloendothelial system. Okay, so I just wanted to share that bit of information with you. You could look on my YouTube page, subscribe there. There's a lot of great information that I give about various kinds of illnesses that I work with, and there's a lot of chronic illnesses. They all have the same common theme: a reduced immune system, too much chronic infection, too much toxic exposure, and too much environmental stress. All right, thank you for letting me share this with you, and I look forward to helping you and sharing more with you.